just a little more background information about the RCA before we get started. The Right Care Alliance is a grassroots coalition of clinicians and community members organizing to make healthcare institutions accountable to communities and put patients, not profits, at the heart of healthcare. Our vision is of a transformed system in which the pursuit of health is a right and healthcare is based on healing relationships, is close to home, affordable, and effective, and just. We all deserve a system in which health professionals and patients alike experience the care they give and receive as necessary and meaningful. So with that, I'd like to also introduce our wonderful panel of speakers today that will be presenting. So we have Ricky Ashby, who is a MD PhD student at the University of Florida, Dr. Frederick Southwick, who is an infectious disease specialist at UF Health and is also the chapter leader of RCA's Gainesville chapter. And then we have Dr. Carmella Elie, if I'm saying that right, who is a clinical associate professor who specializes in emergency medicine at UF and is also the chief medical officer for Haven Hospice. And finally, we have Paul Myers, who is the director of the Alachua County Department of Health. So with that, I'll pass it off to Ricky to begin the presentation.
Thank you. So first off, the purpose of us giving this presentation is to help contextualize the importance of vaccines and essentially some of the myths, to hopefully dispel some of the myths about COVID-19 vaccines and provide some good information going forward. Go ahead to the next slide. So I thought I'd set the stage with what vaccines are and what they do for society. And I think that there's no better way to express it aside from the number of lives saved. And every single one of those lives saved is because of vaccines is another productive member of society who's going to contribute something great for our country and our world. So for every $1 on average that the US invests in vaccines, it gets $44 back because a lot of people don't wind up with these long-term side effects from all of these forgotten diseases, such as measles, mumps, and rubella, for example. And this, on average, saves society $1.5 trillion with a T dollars per year. So imagine, if you're investing in a Roth IRA or a 401k and you get a return on investment of 44, that's pretty good. I would definitely like to have an investment account like that. So vaccines are very important and they have been for a very long time. I got this directly from the CDC. This is a very nicely compiled list of 14 diseases that most people have actually forgotten about because vaccines have been so successful at either eradicating them or almost eradicating them in the United States. So I'm going to focus mostly on polio, though. So I just want to warn everyone, there are some images that may be a little disturbing. If you're squeamish, you can look away. But this is kind of showing what polio is for people who don't know or may not have grown up with polio and how it was discovered and the progress it took to actually get a vaccine for it. So polio was first described in 1894 in the United States as infantile paralysis. It was not known that it was infectious until much later. In fact, this initial doctor report stated that they did not believe it was infectious because not everyone got sick. Back then, they did not know about asymptomatic spreaders. So later on, in 1905, a Swedish physician named Ivar Wickman actually discovered that this is not only infectious, but people who don't exhibit symptoms can spread it to other people. Does this sound familiar to COVID at all? So this is a very common theme in viruses where some people can show symptoms, some people may not. And yet, either way, if you're infected with it, you can spread it. And the common fight for polio really led to a lot of advances. Many viewers may recognize this. This is the iron lung, which is essentially designed as a barometric breathing apparatus for people who became paralyzed from polio. It was so common in the United States, they had to come up with treatments to help people who would die, unfortunately, from having a paralyzed muscle. So later on, radio entertainer Eddie Cantor joined the fight against polio and actually told all of his listeners on the radio to mail the then president, Franklin D. Roosevelt, as many dimes as they could to help find a vaccine for polio. And thus the March of Dimes was born. And a very famous figure that emerged from this era where they raised so much money and tried to create a stop to polio was Dr. Jonas Salk. And I thought this was interesting that back in 1952, there was a lot of progress made for vaccines. There was a light at the end of the tunnel, so to speak, because once they find a vaccine, they can vaccinate everyone. And everyone actually got very complacent. People before this were told they couldn't hang out with their family, they couldn't go to public pools, they couldn't spend a lot of time in unsanitary places. They didn't like that. They want to go back to normal living. And so Dr. Salk noticed this because people were getting overconfident because they were developing a vaccine. And he went on the radio on March 26, 1953, and I'll let his own words speak for themselves. Although progress has been more rapid than we had any right to expect, there will be no vaccine available for widespread use for the next polio season, emphasizing that people still need to take precautions. Later on, eventually they got their vaccine, and they found it was 80 to 90% effective in preventing paralytic polio. And the rest is history. Essentially, the vaccines were distributed, and eventually we were able to make polio a thing of the past.
What Ricky has been talking about is what polio did is it achieved herd immunity. Now, you've heard a lot about herd immunity, and what that is defined as the resistance to spread of an infectious disease within a population because most of the population is immune to that infection. Now, the level of vaccination needed to achieve herd immunity varies by disease, but ranges somewhere between 83 and 94%. To look at this conceptually, if there is no vaccine, the blue is susceptible, the red are infected. So one individual could infect 5 people, and then each of those people could infect others in the absence of herd immunity or vaccination. Now, if a high percentage, say 80% is immune, the green, then when someone is infected, they only spread it to one person. So if you get the spread, the reproductive rate drops below 1, then the epidemic goes away. And that's what you're trying to achieve with vaccination. Now, there's 2 ways to achieve herd immunity. There's a natural herd immunity, and we heard a lot about this during earlier period where people thought, well, we can just let everybody that's not sick or not doesn't have underlying disease and isn't older, let them get the virus, and we'll just naturally achieve herd immunity. The advantages for this are the government doesn't have to do anything. Infection control practices are ignored. Business can go about as usual. And we saw what happened when that occurred, and what did happen everywhere that was the policy, it overwhelmed our health systems, and millions can unnecessarily die, and you can't really prevent spread from those that are most vulnerable and those that are at risk of dying. And another big problem with natural immunity is that the immunity is variable. It depends on the severity of disease. Mild disease may have a poor antibody response, while severe disease may produce long-term immunity. So what would be the price if we said, okay, we're not going to worry about vaccines, we're just going to achieve herd immunity by letting everybody get sick? Remember, it's going to be 80% will have to become infected. So we have 326 million in our population. That would mean 260.8 million would need to be infected to achieve herd immunity. We know that 6 to 10% of those that are infected end up in the hospital. That would mean we would have 15.6 to 26.8 million hospitalizations. In the United States, there are 0.924 million beds. So we would exceed the hospital capacity by 17 to 29-fold. And remember, the death rate is in the US is 1.76%. That would translate to 4.6 million deaths. Now, a country that actually did attempt herd immunity was Sweden. And in 1222, this is the figure from December 22nd of 2020, they had 787 deaths per 1 million. And compared to the other countries near them, Denmark, Finland, and Norway, their death rate was 4.5 to 10-fold higher than these countries who actually did apply infection control. Now, to put this in perspective, the United States, which supposedly has not been trying to achieve natural herd immunity, we actually have 1,041 deaths per million. So we have a higher death rate than Sweden. So, the best way to achieve herd immunity clearly is not natural. It is through vaccination. And that's what happened with the polio vaccine. It's a controlled approach. It decreases hospitalizations. And Paul Myers just told me the hospitalizations in Alachua County are dropping precipitously thanks to the vaccines. It decreases deaths. That'll take a little more time to show itself. It's a potential to confer long-term immunity for everyone. And it's historically a safe and effective approach, as shown with polio and also smallpox. So let's look at our vaccines. And we have two right now, but the Johnson & Johnson was just looked like it might be released in the next 2 or 3 days. But these vaccines are mRNA vaccines. And this curve tells it all. This is the Pfizer vaccine. It's called BNT162b2. And here, the blue is those that received saline injection. The red are those that received the vaccine. And this is look at day 12. This is an enlargement of the same curve. Look at day 12. That's when all of a sudden the vaccine group flattens out and plateaus and stays really very few additional cases. This is 12 days after the first injection. This isn't even the second injection. This is the first injection, showing how impressive this vaccine is. And for the Pfizer trial, they looked at 43,000 subjects. Half were in the control, half were in the vaccine group. They used 30 micrograms of the vaccine versus saline. And there were 8 cases in the vaccine group versus 163 in the control or placebo, a 94% efficacy. Now, so if you look at the vaccine, so this is what happens with no vaccination. The red are those that are infected. The blue are those that are susceptible. And as you can see, everyone rapidly becomes infected when there is no immunity in the population. When a few people are vaccinated, and that's about where we are right now, we're at 13 to 14% of vaccinated, and the vaccinated are in yellow. You see when there are 2 infected individuals, again, there's still a large number of individuals that will be infected, and a few will have natural immunity or are vaccinated. And then if you have 70 to 80% vaccinated, the yellow, you see now when there are 2 infected, that only 1 other person becomes infected. And if the reproductive rate goes below 1, in other words, if 1 person infects less than 1 other, then the epidemic disappears. So what about side effects? So this is clearly an extremely effective vaccine. And the Madura, the other released mRNA, is identical in efficacy. And the side effects of the 2 vaccines are virtually identical as well. So short-term side effects, mild to moderate pain in the injection site, fatigue, headache, fever, chills. Chills are a rarer side effect. In the 23,000 in the vaccine group, there were only 4 severe side effects, 2 with swollen nodes under the arm, axillary adenopathy. 1 person had abnormal heartbeats, and 1 person had numbness of the legs, which resolved over time, and they weren't sure it was due to the vaccine. Now, in addition to the 43,000 that were monitored, now the post-trial vaccine, there have been 10 million doses of the vaccine have been given at the time this was checked. And there were severe anaphylactic reactions in 4.7 out of 1 million. For the Moderna vaccine, the other mRNA, there's been 7.5 million doses, 2.5 anaphylactic reactions per million. This is exceedingly low. very minimal allergic reactions because the constituents of the virus are mRNA, salts, lipids, and a small amount of polyethylene glycol to allow them to freeze the virus or the vaccine. And here is just a bar graph showing the various side effects. And if the first dose, you see fatigue is quite prominent, fever is relatively uncommon, headache, but you notice the placebo also has fatigue, 47 versus 33%. Muscle aches were another prominent symptom. And the second dose, you tend to get a little bit more of these same reactions. So there's more fever, more fatigue, more chills and headaches. And this was those ages 16 to 55. And those above 55, actually the number of these side effects was lower. But the good news is when you have symptoms, that tells you have a vigorous immune response. And even though you feel uncomfortable for about 24 to 48 hours, that is a good sign that your body is reacting to the vaccine. So in conclusion, vaccination is the only way to safely achieve herd immunity and stop the epidemic. And it will take 60 to 90% of our individuals to be vaccinated to achieve that herd immunity. The mRNA vaccines are highly effective, 94 to 95% efficacy. And if you look at actual preventing severe disease and hospitalization, it's 100% effective. mRNA vaccines are very safe, minimal number of allergic reactions and side effects. Vaccine hesitancy is a concern. And if we don't get everyone to want or accept the vaccine, then we're not going to achieve herd immunity. So trust is a key element. And I'm going to ask now Dr. Elie to discuss a little bit about the importance of trust. And one final thing, inequity. It's very important that everyone, no matter their financial or where they live, their race, they receive the vaccine, because we can only achieve herd immunity if we're all vaccinated. So we truly are all in this together. So with that, let me turn it over to Dr. Elie.
Thank you so much, Dr. Southwick. So my name is Dr. Elie, and I'm going to talk a little bit about the vaccine hesitancy. You know, at the height of the COVID pandemic, in fact, I think during the very first wave, we could look into certain cities such as New York City and Atlanta, Georgia, and what we found was the hospitals were full. And very early on, one of the things that we were able to identify was a trend. And of those patients that were in the hospital, we knew that the death rates were fairly high, especially in the beginning when we didn't quite understand how to manage patients. And one thing that we identified was that the number or the proportion of African Americans and Hispanic Americans that were in the hospitals with COVID-19 actually represented a large proportion of the patients that were hospitalized. So in New York, 50%. In the state of Georgia, up to 85% of the patients in all hospitals in the state of Georgia were African American at one point. And so when, in retrospect, when we took a look at these patients, what we also found was that if you looked at populations like the African American population and the Hispanic American population, they were dying at rates that were 2 or 3 times as high as the non-African American population. So these were sobering statistics because they were inflicting a population who, in many ways, had a lot of comorbidities, but their mortality definitely outstripped the mortality of folks who were not of those cohorts. And so now the vaccine's available, and it has been widely distributed. And admittedly, the vaccine's not available to everyone yet, but it certainly will be. But there's something that we found, which is in providing the vaccines to the general population, when comparing the populations of patients that are getting the vaccines versus not, what we found is that the rate of vaccination amongst the population of those who were inflicted the greatest, the African American population, is 8 times lower than the general population. And so the question is what's going on? And there's certainly not just the African-American population, but certainly a lot of other populations are also a little hesitant about getting vaccinated. But the question is it's probably something that we need to spend a little bit more time talking about if the population that we know is at great risk and vulnerable is avoiding or hesitant to getting vaccinated. And I want to talk a bit about trust and vaccines, or trust in healthcare in general. There is historical context around trust in medicine, especially for the African American population. Historically, there are the events that are characterized by mistrust because of what perhaps scientific investigations were being conducted. So in the example of the Tuskegee trials, where African Americans were exposed to an infectious disease and were not offered a treatment and were experimented upon without their consent. There's another very famous event where a woman with cancer passed away from her cancer, and her cells were ultimately reproduced and utilized for future studies, and her family nor the patient were really aware that her cells were being utilized for that purpose. And subsequent to that, there is the issue of the lack of representation by people of color in scientific investigations when studying drugs, and the utilization of those drugs in populations that perhaps had never been, within which they had never been tested in the first place. And then finally, there is testing and investigation that goes on in populations of color, but the results of that testing and perhaps the outcomes of that testing are not shared with that population. And so because of these events, there is some justifiable lack of trust and lack of engagement by people of color in many communities. And so I think that justifiably that many people feel as if perhaps they shouldn't necessarily be on board to getting vaccinated with medications that are recently being made available to the general public. And so with that information, I think what we all have to do is just pause a moment and think about what we've been doing in the scientific community and in the community at large in order to regain that trust, and think about how to ensure that all populations have access to these vaccines that need it the most. So the first thing I wanted to bring up is that the scientific community is very aware of these prior events in history and have made strides, although we haven't gotten to a point where there's a completely level playing field. One of the things that the scientific community has done is ensured that there's representation in all of the clinical trials by people of different genders and different races. And so you can be we're assured or reassured that in investigating the COVID-19 vaccines, that they did include African Americans and Hispanic Americans in those initial clinical trials to ensure that there was representation by multiple races, right? And so in doing so, we have a really good understanding of how different races are impacted by those vaccinations. So that's the first. The second is that there is engagement and understanding and ensuring that everyone not only gets vaccinated, but also that everyone understands what those outcomes are, right? The beneficial outcomes, which would include not being hospitalized or not experiencing a death. And the studies are specifically looking at those people of color in particular to ensure that the outcomes are beneficial and actually valued by that population as well. And so it's important to know that there are efforts being made to ensure that the vaccinations are not only available, but that people of color know that these vaccines are also safe in their population. And so in making these statements, I also wanted to say that it's important to recognize that when we all get vaccinated, that we're not only protecting ourselves and ensuring that we are in good health, but we're also protecting our neighbors. And many of us are or in households where there may be elderly individuals. And in protecting ourselves, we are protecting our parents, protecting our neighbors, and protecting those with whom perhaps we may go to church with or go get our hair cut with. They are also vulnerable, and in many ways that I'm really happy that there was that presentation on polio. The generation that came before me, or the several generations that came before me, protected me by getting those vaccinations so that I didn't have to suffer from being inflicted with the polio vaccine. And now we have the ability to return that favor to those generations that protected us so that we would be here today. I think we have a lot of work to do in the medical community to engender trust with all of our patients. I just wanted to make sure that everyone understood that it's an area that we know that we have to earn, but we're making strides to get to a point where we can share information with our patients so that they understand that we want to meet them where they are and protect them as much as they want to protect themselves and their families. And I'll take any questions, and I know that there's other speakers after me, but I'll take any questions afterwards.
Great. Yes. Thank you, Carmella. That's really, I think that's the essence. As doctors, we've seen these individuals suffer so greatly, and many of them have been African American who have suffered from COVID-19. If I could have a wish, I would wish that no one ever had to suffer like that. And so I've gotten the vaccine. I know you've gotten the vaccine, and every healthcare provider that's taking care of these patients has gotten a vaccine because they realize how important it is and how it can save, we can save lives, including our own and our loved ones. And he's doing a spectacular job. And this Department of Health, I've got to tell you, I've worked with it for over 25 years, is one of the most outstanding departments in the state of Florida. And we're very lucky to have Paul and the department to help us during this real true crisis. So Paul, take it away.
Thank you, Dr. Southwick. And I'll share with Tom that you had mentioned his name to me because he is my mentor, and I worked for Tom for 20 years. So good evening, everybody. It's my honor to be here. And so when we first started rolling out and planning for this mass vaccination, these mass vaccination clinics, I knew that in Alachua County, we were very well positioned because we have been running a school-located influenza vaccination program for over 12 years in Alachua County. We go into our public and private schools every single fall. We vaccinate as many of what we like to call the super spreaders as possible. Of course, kids are not the super spreaders with COVID-19. But my point is that we had the infrastructure in place in Alachua County to vaccinate thousands of people. And so I knew that we were ahead of the curve in terms of being well positioned to be able to do that. Access, and previous speakers have talked about this. Access is a big deal. And when we started to design the access to the vaccines, we wanted to ensure multiple ways that individuals could sign up to get vaccinated. And we are pretty adamant here that the appointment system is the way to go. I think that you have seen news reports in other counties where they have these on-demand or walk-up systems, and you see these images of very frail individuals wrapped around buildings. That's not something that we embrace here. And so we went with an appointment system. And so there's really three main ways that a person can access the vaccine. And when we were designing this and planning for it, unlike the school program where the consent form is the we like to call it the choke point, because if we don't get that consent form back, we can't vaccinate children. In this case, it's really making an appointment. And so we want to transcend that digital divide. And so there's three main ways. One, you can give us a call at 352-334-8810. That's probably not the ideal way to go because of course our phone systems are pretty busy, although with the second way, it has taken a lot of pressure off of our phone system. And the second way is to access our registration system. If you will go to our website, which is alachua.floridahealth.gov, you will see on the front page a way that you can register. And in that registration, we're just going to ask you some basic questions. What your name, your date of birth, an email address, a good phone number, preferably a mobile phone where we can text you. But if you don't have a mobile phone, put in your landline. That's fine. if you're not comfortable with the online system, we can give you a call when we schedule these clinics. And I just want to make it clear that we don't schedule clinics here until we have the vaccine in hand. And the reason for that is the supply chain has not been very reliable, although we have a lot of contacts throughout the state to where we have been pretty successful in not having to reschedule clinics. To date, we've only had to reschedule one. And if you're in that group that was rescheduled from February 18th at Trinity United for your second dose, that's been rescheduled for this Monday. And those text messages, those emails, and those phone calls started going out today. So that's the second way, is to register online. And the third way is really for those individuals who aren't comfortable on the phone or not comfortable online. We provide blocks of appointments to various community organizations. We started off with the school system because that was really a controlled environment, and that was very successful. We vaccinated hundreds and hundreds of teachers that were 65 and older, and also retired teachers through the drive-through over on Hull Road on the University of Florida campus. And so we extended that out into the community with some faith-based organizations in East Gainesville. You know, almost every Friday we have a call at 6 o'clock with the Alachua County Pastors Association, headed up by Reverend Carl Anderson and some of his colleagues, and Dr. Lizardo from UF Health, and where we talk with elected officials and we talk through some of these trust issues, because we know that that's you know, certainly a barrier. Trust is a huge factor. In fact, this past weekend, we partnered with the Rotary Club, where they knocked on over 500 doors in East Gainesville, talked to over 140 individuals, and we're able to register 33. So if you do the math, we have a lot of work to do in order to gain the trust of individuals that are out there. And so, you know, that boots on the ground, the online systems, the telephone systems, we really are trying to, and we're open to other ideas. You know, we really are trying to make access something that is not a barrier. And my goal from the outset of this is to have the vaccine supply be the limiting factor, because that's the one thing that I can't control. Everything else is in our control, and it would be a real shame if we had a lot of vaccine and not a good method to get it into people's arms. And so Dr. Southwick just put up some of our clinics in East Gainesville. We've had a number of them. This is just some of the things that we did this week. Was it yesterday? We were at Praise Church. We have one of our first clinics, and it's an ongoing clinic at the MLK Center there on 8th Avenue and Waldo Road. And these clinics continue to be scheduled once we have that vaccine in hand. And so, again, access to us is an issue that we constantly try and address. And I know that our systems are not perfect, although they have been improved with the collaboration of UF Health and the IT support that we have received from them. So with that, I'll stop and see if there's any questions. Or Dr. Southwick, turn it back over to you.
Great, thank you. Now, Celine is going to read. We had a number of questions during the registration, and we thought we'd address those, and then additional questions can be shared in the chat as well. So, so Celine, do you want to go over these questions?
Yeah, sure. So first, I just wanted to say we did get a lot of questions. So I tried my best to compile what I saw the most. Obviously, some of them were a lot more specific. I just tried to make it general so everyone could benefit from it. So first we have, are the vaccines effective against new strains of COVID?
Yeah, and I can address this a little bit, in that there are 3 strains that have really become prominent. The most prominent is the United Kingdom variant. It's called B1.1.17. And it's a point that you've got to keep in mind is this is an RNA virus. RNA viruses are very poor at proofreading, and they make mistakes, point mutations all the time. So the more the virus is out there infecting people, the more likely it is to mutate. And then if you get a mutation that's of functional advantage, as this one was, there's a single mutation in the spike protein. The spike protein is the protein on the virus surface that binds to the ACE2 receptors of human cells, allows it to get into the cells and infect them. All our vaccines are directed against the spike protein, all of them that so far that have been released. And so there was a mutation of one amino acid, asparagine for tyrosine, that markedly increased the stickiness of the virus to cells. And as a result, it spreads 50 to 70% more efficiently. The good news is because it's only a single mutation in the spike protein, the vaccine works equally as well on this as the regular virus, the wild type virus. So we don't have to worry about this from the standpoint of vaccine. However, there are two others. The South African variant, B1 3.51, it also has this N to Y or asparagine to tyrosine to 501, making it more infectious, but it has two other mutations. And as a consequence, the actual conformation, the folding of the spike protein is different. And the antibodies do not bind as tightly to block the spike protein. And so with what we're seeing is decreased efficacy. And we don't have the AstraZeneca here, but the J&J is about to be released, and it dropped from 72% efficacy to 57%. So far, the Moderna and the Pfizer, the two that we're getting now, it looks like they are pretty much equally powerful, efficacious. Might be a slight reduction, but so far it doesn't look too bad. Now the third one, and this one, fortunately, as far as number of cases in the United States, the United Kingdom, I think there are about 1,400, and it's in 42 states. The South African, I think it's in about 12 states, and there's about 50 cases. The Brazilian variant is only in 3 states, one of them being South Carolina, and it's only, I think there are only 8 to 12 cases so far. It has 10 mutations in the spike protein. So it is very likely that the vaccines are likely not to be as effective for this. And they have seen decreased efficacy for the J&J, but I should predict we haven't studied yet, it may be harmful. So what this means is that there are these mutants out there, and all the vaccines are directed against the spike protein. And what we're looking at, what we're seeing here is Darwin's survival of the fittest. These mutations are occurring, and the more fit viruses are taking over. The longer it takes for us to achieve herd immunity, the greater the risk the mutants will escape the vaccine. And so it's really important that we try to reduce the spread of these mutants by continuing to wear masks, continuing distance, continuing to avoid crowds and closed spaces. So we can, as Ricky said, we cannot let up, because these mutants are out there. And I understand there's some new ones in California. There are others in Minnesota. So there are mutants everywhere. So it's very important to maintain the same practices. So let's go back to the questions. So
The next question we have.
I think we answered that one.
Oh yeah. So we'll go to the third one. What are the differences between the vaccines in effectiveness and reactions?
Okay, so as far as I have a little table that actually looks at the efficacy of all the vaccines, and the Pfizer and the Moderna, the two are out now, are equally efficacious, 95 and 94%. And when it comes to preventing hospitalization and death, 100% effective. Their side effect profiles are virtually identical. You can't differentiate them. The AstraZeneca and the Johnson & Johnson, they're a DNA virus. They are not as efficacious. They're more 60 to 70%. And in South Africa, it looks like they're going to reduce efficacy from 66 to 57%. However, all these viruses also are 100% effective as far as reducing hospitalization and death. And those are the most important. And finally, there's one that's not been released yet. It's actually a protein virus or vaccine, very much like the pneumonia vaccines and our Haemophilus influenza, our Hib vaccine. And that has a very high efficacy, 89% and 100%. And again, in the South African, it's less effective. The side effect profile there looks very good as well. So that sort of takes care of all the different vaccines. So the next question.
Should you get the vaccine if you have had COVID in the past?
Okay, so there's a slide that answers this. If you have a natural infection, it depends on the severity of the infection. This is a graph showing the level of antibodies and the duration of the infection, how long the infection's been going on. You can see that antibodies begin to develop at day 10 to 12, and in mild cases, they only go up a modest amount, immunoglobulins, and then they quickly decay within 1 to 2 months. In severe disease, they go up to higher levels and persist. So you can't guarantee. So what we recommend is even if you had the virus, you should get the vaccine. There's some debate whether you need 2 vaccines or just a single shot, and that's still being debated. But the answer is you should get the vaccine. Now, the other question, there was one other very important question. A lot of people are concerned about this, right? Since the vaccine was developed so quickly, is it safe? And Ricky I had some slides. Ricky, do you want to address this question?
Yeah, you just go ahead with my part. Yeah, so you can stop there. So I wanted to use this to just kind of give a little analogy. Instead of me going into a whole bunch of, science and random papers, I thought I'd give a little bit of an analogy here. Back in the 50s was when the polio vaccine came out. That took many years, right? Well, let's just look at our smartphones now. The 1950s versus 1980s versus in 1990s. I mean, even then, just compare all of the advances we've had. Something as simple as a phone. You can go to the next one. Yeah, just click. And, flip phones even, just from 20 years ago. Just imagine having it. No one can even, yes, I do love flip phones. Don't get me wrong. If anyone has a flip phone, I don't want to, offend anyone. But my point is that technology has just vastly improved to the point where someone in the 1950s could not even imagine the concept of a smartphone. They didn't even have computers back then, let alone the concept of having a computer in your hands that is bigger than a computer that would take up an entire room back in the 50s. Things are just faster in the way that we can use them. And so this is a slide I wanted to do to kind of assuage some of the fears of the mRNA vaccine too, because there's a lot of misinformation about it. So in biology, we learn about the concept called the central dogma of life, which is the fact that we have this code called DNA, right? So this is actually taken from the Moderna website. And I thought I'd use the material because it's just done so well to explain to the public. DNA is just kind of like your memory, like the storage on a computer or something. And then you have mRNA, and that's basically just carrying a message from the DNA to a protein, to create a protein essentially, kind of like the application on a computer, if that makes sense. So you can click the next one. The mRNA is just a messenger. That's it. It doesn't affect the DNA at all. So the notion that I know that there are some myths out there that the vaccines are going to affect your DNA or something like that. It's just not true. It's mRNA. One of the big advantages to it is that there's no risk for causing any mutations on your cell's genomes, essentially. It just delivers what your cells need to make the protein to make the antibody response. And there's another myth that it's an untested technology. So mRNA has been around since literally the 1990s. I thought it came about in the 2000s, but actually it's been pioneered by some this scientist specifically, but other scientists as well, as far back as the 1990s. And it was originally considered too innovative, interestingly enough, for its time. And these mice in the 1990s were, these experiments in the 1990s were done on mice, showed that it was safe, showed that you can use it for vaccines, essentially. And the rest is history. Nowadays, there are ongoing trials where we use these mRNA technologies for vaccination. In the case of COVID, we use it for cancer therapy, for gene therapy delivery, for research and development, for figuring out different gene functions. And there's a lot of different ways that we use this. So it's a very safe technology, and we've known about it for a very long time. There's just never been an urgency to use it so fast, if that makes sense. And the fact that we have a technology and it just works way better is the main reason why it's came out so fast. And it's also important to note that we also had an immense amount of funding as well. I think that's on the next slide. I think
I actually left that slide out, but I just, Ricky, one other thing. This is just shows the classic time to develop and release a vaccine. And the first takes at least 3 months to figure out what the vaccine is. And then you have phase 1 where you study in animals. Phase 2 is early to see if there's toxicity in humans. And then phase 3 is a larger trial where they really determine efficacy. Then they have to manufacture it and then they distribute it. So 3 months, 5 months, 21 months, 23 months, 15 months, 6 months. So 73 months was the average. What happened here is they actually designed the vaccine within 4 days after the sequence was developed. And then they went right to phase 1 right away. They did phase 2 and phase 3, ramped up the phase 3 once the early phase 2, but they kept doing the phase 2 and the phase 3. And then the companies, because they got money from the government, started manufacturing it immediately while the phase 2 and phase 3 trials were going on so that they could actually distribute the vaccine very quickly. So they did not skip any steps, the same number of steps, but they were done in 14 months. So that's sort of the key. So I think those are all the major questions from the pre-questions. Do others have questions in the chat or want to unmute? There may be questions for Dr. Elie and Paul Myers.
I have a question.
Yes.
I have friends that got their first vaccine, now have COVID, mild cases. Their second vaccines are scheduled for, I think, the 7th and 8th of March. Should they get those second vaccines?
Yes.
Paul, I don't know if you answer that question or would.
Well, I would just go on the guidance that we have right now. And if you are within your 10-day isolation period, in other words, you're a confirmed case, then we would ask that you delay getting vaccinated until after that 10-day isolation period, number one. And number two, what we have seen is with those who have had recent infection, their reactions to the vaccine tend to be a little bit more, I'm not going to use the word severe, but a little bit more uncomfortable. But I would refer to the physicians on this call because that is that's an interesting question.
Yeah, I think the conclusion has been that you should get the second dose, and that you may have, as Paul said, you may have a little more reaction, but it will, and particularly if you're older, it's unlikely to be, what we recommend is you don't take aspirin or ibuprofen or Tylenol before you get the vaccine, because that seems to actually limit your reaction to it. But if you start to get fevers, 3, 4, or 5 hours later, you can take, at that point, it will not interfere with your ability to generate the immunity. So that's been a big problem in kids. They were always worried about, and there's a lot of studies on that. You shouldn't give it preventatively, but you can give it if you get symptoms. That's okay.
Thank you.
Yes. Other questions?
So we do have a question in the chat from Pam. We have read that the CDC is currently stating that the vaccine will not prevent you from transmitting or receiving the virus. So how can we attain herd immunity? So I can answer that if you
go ahead. Yeah.
Okay.
He actually has a degree in public health. In addition to getting his MD and his PhD, he's going to be one of the most educated physicians in Gainesville.
I wouldn't go that far, but I can answer this question. So the issue is not whether or not it prevents you from transmitting the virus. So the thing is, as we know from most other vaccines, pretty much every single other vaccine, this is going to cause you to have an immune response to it. So it will reduce transmission among each other. There's a lot of things that go into you transmitting the virus to someone else. One of them is how much virus you're giving off. If you are really sick, you're going to give off a lot of virus to someone else, and they will get more sick because that's a bigger inoculum to begin with. So it'll definitely reduce transmission. And there's some early data to suggest that, but we almost knew that was going to be the case, but we don't know how much. And that's the problem, is it could be that it only reduces it by a little bit, and we need everyone to be vaccinated. And we also need everyone to social distance and have lots of precautions. And it's only going to get more complicated when we have more of these variants going forward. So that's why the CDC is trying not to confuse everyone, but also to emphasize that everyone needs to stay cautious, if that makes sense.
Yeah, and the next question sort of relates to, is it safe to spend time with other people who have also been fully vaccinated without masks and social distancing? Right now, I would be very cautious. The problem is these mutants. If someone who is vaccinated happened to come in contact with one of those mutants, then they could theoretically spread it to the other individuals who are vaccinated. And the problem right now is we don't have herd immunity. So there's tons of virus all over our environment right now. So even if you're vaccinated, you want to wear a mask, and you want to assume that you could carry a mutant virus. There's one of the really frightening tale occurred in Brazil. There was one region of Brazil where over 70% of the people got the wild type virus. They said, we've reached herd immunity. Everybody stopped using masks and just went about their business. Well, that's when that Brazilian mutant with the 12 different mutations in the spike protein showed up, and there was a giant surge of infection as a consequence of this. So we cannot, until there is true herd immunity, and Paul tells us there's no infection in Alachua County, then we can think about not wearing masks. Until that day, we really need to wear masks, and we need to socially distance. We have to avoid closed spaces where there are many people in them.
And there's another question right under that by Pastor Dave. Was tissue from aborted children used in the development and production of the vaccine? What was this question not presented when originally asked earlier today? So I apologize for that. I did not see that question. So there is, I know that certain religious groups do not want anything to do with aborted fetus. Let me reassure you, first of all, from a research perspective, it's illegal to do that. That's not used. So a lot of this comes from a misunderstanding, because there is a cell line known as human embryonic kidney cells 293 that was derived from a fetus in the Netherlands way back in the 70s and was continued to grow. And that's used in some research, but that was not used in this specifically, because it's just mRNA that's put into lipid nanoparticles. So no, there was not any tissue from aborted fetuses used at any point in development or production of this vaccine. And there was not any use of those HEK293 cells that I was talking about, which is derived from fetal tissue from the 70s. None of that involved. Okay, easy to answer.
And then here's a question. Do you know when the vaccine will be available for people with high risk under age 65? That's Paul.
So right now in the governor's executive order, which we are all following, or we're supposed to be following, there is a provision for hospital providers to vaccinate those who they deem to be at high risk. And so that's where I place that population. If you have a hospital provider who is managing your disease, and he consider or she considers you to be at extremely high risk, then they should have access to the vaccine.
Good. Okay, there's a question about my husband was told he cannot get the vaccine because he has an allergy to Percocet and latex. He's over 65 and he's tried to schedule it. He's been turned down each time. How is he going to get vaccinated then? I think, Ricky, you want to talk about that?
No, I was actually going to ask you. Allergy
That's
to
a very
latex.
gray zone. I'm surprised. The only people who they're very cautious are those that have severe allergies to
Yeah.
multiple things where they have to walk around with an EpiPen.
And those are really serious. Like, I don't know if
The UK, the two anaphylactic reactions were people that had multiple reactions to hundreds of different things. This is just two standard allergies. I think if you could go to it's probably best to go to a health facility. And what we're doing is everybody has to wait 15 minutes after the vaccine to make sure they don't have a immediate hypersensitive reaction. But there is no reason that I know of that he cannot receive the vaccine.
Yeah, because the thing is, there's been clinical talk about this, and the thing is, even if worst case scenario, he was someone who was really allergic, the thing is, it's still recommended to get the vaccine because you can treat anaphylactic reactions. You can't treat COVID.
Exactly.
So even in some of those cases where someone is really allergic to everything to the point where they need to walk around with an EpiPen, they still actually recommend that those people get vaccinated too. So I don't know why these places are turning you down. That's very strange. That's at least against good medical practice.
Well, has that been happening in your clinics, vaccines?
You know, there's a lot of interpretations out there, and unfortunately, there's some inconsistency with people being denied the vaccine by physicians and nurses who are looking at the contraindications to this in the consent form and making their own interpretation. So it has been a challenge throughout this, just because of the shifting guidance and the constantly changing guidance, for that matter.
Yeah, but I think really the risk of the virus is so much higher than allergic reaction, which can be easily handled. I mean, you should probably go to a medical clinic or somewhere where there are healthcare professionals right around, because these anaphylactic reactions we deal with them quite frequently with different products, and an EpiPen works beautifully, and you can quickly get support. So it's really very manageable, very manageable. So as Ricky said, I would definitely get the vaccine.
So there was another question from Toby. Any consideration being given to using a mobile clinic to administer vaccine in areas where transportation is an obstacle? I do know that in other counties, they are considering this. The issue in those other counties, I don't know about this county, is how do you follow up with that exact same person exactly 1 month from that time point, if that makes sense?
So I can take that. Whenever we do our outreach and we ask people, do you have an issue with transportation? Do you have a mobility issue? Are you homebound? And so far, with our agreement with Gainesville Fire Rescue and Alachua County Fire Rescue, we have vaccinated over 200 individuals who have responded, yes, they need that sort of direct accommodation. And so and to Dr. Southwick's point, these are medical professionals who sit with this individual for the requisite 15 minutes for the observation period. And then they follow up with them. So we provide the vaccine, and the fire rescue personnel administer the vaccine and do the observation.
Good. Yeah. Well, one of the things that, there are naturally in a large community, there are all kinds of unforeseen obstacles that, and this happens with any vaccine. But in this case, this is such a life and death issue. And the Right Care Alliance, we've got your names. We are going to actually work with Paul. We're going to work with UF Health. We're going to work with the churches to try to help facilitate. And those of us who have medical training are going to volunteer to help vaccinate people, because I can tell you that all health professionals who have dealt with this virus understand the importance of the vaccine and want to do everything we can to make it easy as possible and to encourage everyone to take this vaccine. So this is going to be our campaign over the next 2 or 3 months. And I talked to Paul about this. Wouldn't it be wonderful if we could achieve herd immunity in Alachua County, and we could be the first county to achieve it? Wouldn't that be great? We would all, businesses could open. We'd have to be careful, other people coming into our county, but that is a possibility. We're really efficient. We're doing a great job. We've got UF Health, we've got North Florida, we've got all the churches pitching in. Paul's doing it, and the Department of Health is doing a great job. So I think that's a real possibility. Carmella, do you have any thoughts on this?
So I think it is a possibility. I think that if each of us does our due diligence in educating our colleagues, our patients, our family members, our neighbors, that there's an opportunity for us to get to a point where herd immunity is a possibility. And it's so necessary. We're not just taking care of this generation, but future generations. And so we all have, I think, a personal responsibility to take care of ourselves and each other. So I completely agree with you there, Fred.
Yeah, and one of the future generations, one of the big concerns right now is opening our schools.
Yeah.
If we can get everybody vaccinated and the reproductive rate drops way, way down, all the guidelines of the CDC say that schools can open up. They still have to wear masks, but they can have school almost as usual. And they can actually go to 3 foot into even 6 foot if we could get it down. The more we vaccinate, the lower the reproductive rate, the more we wear masks and stay and just hold tight on these different methods, the more likely we are to have a more normal life for our children. I think this is really, really important right now. We owe it to our children to get them back to school.
Hey, Dr. Fred.
Yes.
This is Stan.
Hi, Stan.
Are we doing any of these town hall informational type things in the rural areas outside of Gainesville, like in Alachua, High Springs, Newberry, in the rural
I would
areas of
really
Alachua
like
County?
to do that. One of the things I tried to do, and I don't think we got many people on, I actually went to the barber shops in East Gainesville. I tried to find them and I couldn't find very many of them. And I handed out a little poster with a QR code for this meeting. But I do think if the question, the issue is, and this is the issue in East Gainesville, how do you get the message out? How do you convince people? How do you announce these type of things?
Yeah, I'm over here. I'm not as my experience is not an East Gainesville experience. I'm more of a country rural.
Right. Yeah, but that's important too.
And right. I'm asking the same questions about the rural areas up in High Springs, Newberry, and
right. Well, I think what we need to do is we need to have a meeting just about this. Come up with ideas of how this is a campaign. If I ever saw a campaign, this is a very important campaign.
I know
the more ideas, the better.
We're doing something with. We have a small community radio station up in High Springs, and we're getting ready to have an election in Alachua in April. Qualifying ended, yesterday. So we got messages and calls to do a candidates forum. So I'm thinking we could do something similar like that.
Absolutely.
Just like for this information also.
Stan, I'd love to talk with you on that as well. This is Jeff. I'm with the RCA as well. And I live in a very rural community in Williston.
Jeff,
same type of thing.
Where are you, Jeff?
He's near Ocala. Toward Ocala.
Yeah, I'm in Williston.
Yeah.
And who is Jeff? Where's Jeff? Oh,
Jeff's on his phone.
Okay.
All right, I'll come on camera for a minute.
Okay, Jeff. We can get together and talk about it if you want to.
Okay.
Yeah,
Dr. Fred has my information.
Okay, well,
Absolutely.
everybody, if you could email me, if you're interested in helping in this campaign, we're going to try to get the more people we can get out, get the message across. The Rotary Club's working on it. It's really exciting. I know medical students are working on it, and we can get the communities, the rural communities to work on this. And our goal is for Alachua County to achieve herd immunity. Right, Paul?
Yes, sir. Absolutely.
Great. Excellent. Well, I think we ought to end now. Thank you. This has been just terrific. And Paul, thank you. And Carmella, thank you. And Ricky, thank you. This is It's spectacular. I really appreciate it. Bye, everyone.